Transverse myelitis refers to inflammation across the spinal cord, and there can be a variety of causes of that, including immune causes like multiple sclerosis, but it can also be caused by infection or some other things. We're interested in defining the cause. So transverse myelitis is a syndrome. It's like chest pain, and there are many different causes of chest pain. As we know, you can have a heart attack, or you can have a clot in your lung, or you could have pneumonia. And the same is true of transverse myelitis. It's inflammation of the spinal cord, but there are many different causes. And a lot of the work we do here at Mayo Clinic is trying to find the exact cause, because many patients are referred to us where the local neurologists have a hard time figuring out the exact cause, and they send the patients to us for additional help. And what we look at is look at the MRI and see if there's a pattern of abnormality in the MRI that can tell us what the diagnosis is. And then we look at these antibody markers that we test for in our neuroimmunology lab that can be a marker of transverse myelitis and tell us the exact cause. And then we look for things like multiple sclerosis with the spinal fluid and the MRI analysis. So lots of the work we've done here is trying to figure out the exact cause. So when a patient comes here and they don't know the cause, that we can work with all these tests and try and figure out the cause for them. The first line of treatment is generally steroids. So patients will often get steroids intravenously or through the vein, and they'll get a high dose to reduce the degree of inflammation there. And then there's some additional tests you can do. There's one called plasma exchange, where we remove bad antibodies from the body that we think might be attacking the spinal cord, because we know that sometimes the immune system is a little overactive, and sometimes there can be an antibody in the blood system that attacks the spinal cord, and by removing those antibodies that can help also. Usually with the steroids and with the treatment, the patients will improve, and some patients with milder symptoms will get completely back to normal, but on occasional cases patients can have difficulties with strength and some residual numbness after the episode. So we try and use these treatments to try and get patients back as much as possible, and I think we've made good advances with that over the years with these treatments.